Hello everyone, I'm Dr. Sarah Mitchell, and I've been practicing internal medicine for over 20 years here in Portland, Oregon. Today, I want to talk to you about something that affects millions of people, especially as we get older. Nighttime? Leg cramps? If you've ever been jolted awake by that sudden, intense pain in your calf, you know exactly what I'm talking about. It's that excruciating feeling where your muscle feels like it's twisted into a knot. And no matter what you do, you can't seem to make it stop. Just last week, I had a patient, Margaret, who's 68 years old, come into my office looking absolutely exhausted. Her eyes were red, she had dark circles under them, and she looked like she hadn't slept properly in weeks. She told me she hadn't had a good night's sleep in months because of these painful leg cramps that would wake her up almost every night, sometimes multiple times. She said the pain was so severe that she was actually afraid to go to sleep. She would lie in bed, tense and worried, wondering when the next cramp would strike. This is more common than you might think. And I want you to know that you don't have to suffer through this. Margaret's story reminded me of so many other patients I've seen over the years. There's Robert, a 72-year-old retired carpenter who used to work with his hands all day. He started getting leg cramps about 3 years ago, and they became so frequent that he began sleeping in a recliner because he thought it might help. It didn't. Then there's Linda, a 59-year-old teacher who's been dealing with leg cramps for the past 5 years. She told me she's tried everything from eating bananas to taking expensive supplements. But nothing seemed to work consistently. What all of these patients had in common was that they thought leg cramps were just something they had to live with as they got older. They assumed it was normal, an inevitable part of aging that they just had to endure. But I'm here to tell you that while leg cramps do become more common as we age, they are not something you simply have to accept. There are real, practical solutions that can help prevent them and techniques that can stop them when they do occur. Let me start by explaining what's actually happening when you get a leg cramp. Essentially, your muscle is contracting involuntarily and won't relax. Think of it like your muscle getting stuck in the on position. The technical term for this is a sustained involuntary contraction. The most common place for these cramps is in your calf muscle, specifically in what we call the gastrocnemius muscle. But they can also happen in your feet, your hamstrings, and even your thigh muscles. When a cramp happens, the muscle fibers are essentially locked in a contracted state. The normal process of muscle contraction and relaxation involves a complex interplay of electrolytes, nerve signals, and blood flow. When any part of this system is disrupted, you can end up with a cramp. The pain you feel is actually your body's way of telling you that something is wrong, that the muscle isn't getting what it needs to function properly. Now, many people think leg cramps are just an inevitable part of aging, but that's not entirely true. While they do become more common as we get older, there are usually underlying causes that we can identify and address. In my practice, I've found that the vast majority of leg cramps can be prevented or significantly reduced once we understand what's causing them. The 3 main culprits I see in my practice are dehydration, electrolyte imbalances, and poor circulation. But there are actually many other factors that can contribute to leg cramps. And I want to walk you through all of them so you can identify what might be causing yours. Dehydration is probably the most overlooked cause of leg cramps. And it's something I see constantly in my practice. As we age, our sense of thirst decreases significantly. This is partly due to changes in our hypothalamus, the part of our brain that regulates thirst, and partly due to changes in our kidneys' ability to concentrate urine. Many of my older patients simply aren't drinking enough water throughout the day, and they don't even realize they're dehydrated. When you're dehydrated, several things happen that can lead to leg cramps. First, your blood becomes thicker and more viscous, which means it doesn't flow as easily through your blood vessels. This reduces the amount of oxygen and nutrients that reach your muscles. Second, when you're dehydrated, your body starts to Conserve water by reducing blood flow to non-essential areas, including your muscles. Third, dehydration affects the balance of electrolytes in your body, which we'll talk about in a moment. I always tell my patients to aim for about 8 glasses of water a day, but this can vary depending on your size, activity level, and the climate you live in. If you live in a hot, dry climate like Arizona or Nevada, you'll need more water. If you're very active, you'll need more water. And here's something important. Don't try to drink all your water at once. Sip it throughout the day. Your body can only absorb so much water at a time, and if you drink too much at once, you'll just end up urinating most of it out. One trick I share with my patients is to keep a water bottle with you at all times and take small sips throughout the day. Some people find it helpful to set reminders on their phone to drink water every hour. Others prefer to drink a glass of water with each meal and snack. Find what works for you, but make sure you're getting adequate hydration. Electrolyte imbalances, particularly low levels of potassium, magnesium, and calcium, are another major factor in leg cramps. These minerals are essential for proper muscle function, and when they're out of balance, your muscles can't contract and relax normally. Potassium is crucial for muscle function because it helps regulate the electrical activity in your muscle cells. When potassium levels are low, a condition called hypokalemia, your muscles become more prone to cramping. Many things can cause low potassium levels, including certain medications, excessive sweating, diarrhea, and not eating enough potassium-rich foods. If you're taking certain medications like diuretics for high blood pressure, you might be losing these important minerals through increased urination. Diuretics, also known as water pills, work by helping your kidneys remove excess sodium and water from your body. But in the process, they can also cause you to lose potassium and magnesium. If you're taking diuretics and experiencing leg cramps, this could very well be the cause. Magnesium is another crucial mineral for muscle function. It works as a natural muscle relaxant and is involved in over 300 biochemical reactions in your body. When magnesium levels are low, muscles can become hyperexcitable, meaning they're more likely to cramp. Magnesium deficiency is actually quite common, especially among older adults. Because our ability to absorb magnesium decreases as we age, calcium is the third important mineral. When it comes to muscle function, it's involved in the actual process of muscle contraction. When calcium levels are low, or when the balance between calcium and magnesium is off, you can experience muscle cramps. The good news is that you can usually correct these imbalances through dietary changes and, if necessary, supplements. Foods rich in potassium include bananas, oranges, potatoes, spinach, and avocados. For magnesium, good sources include nuts, seeds, whole grains, and leafy green vegetables. Dairy products, leafy greens, and canned fish with bones are excellent. Sources of calcium. Poor circulation is the third major cause of leg cramps that I see in my practice. As we age, our blood vessels lose some of their elasticity, and our circulation naturally becomes less efficient. This is especially problematic in our legs because they're the farthest from our heart, and blood has to work against gravity to return to our heart. When circulation is poor, your muscles don't get adequate oxygen and nutrients, and waste products, like lactic acid, can build up in the muscle tissue. This creates an environment where cramps are more likely to occur. Poor circulation can be caused by several factors, including atherosclerosis, where plaque builds up in your arteries, diabetes, which can damage blood vessels, and simply being sedentary for long periods. But there are many other factors that can contribute to leg cramps. And I want to make sure we cover all of them because the solution for your leg cramps might be something completely different from what works for someone else. Certain medications can increase your risk of leg cramps. We already talked about diuretics, but there are others. Statins, which are used to lower cholesterol, can sometimes cause muscle problems, including cramps. Some blood pressure medications, particularly ACE inhibitors, can affect electrolyte balance. Even some antidepressants and medications used to treat osteoporosis can contribute to leg cramps. If you're taking any medications and experiencing leg cramps, it's worth discussing with your doctor whether your medications could be contributing to the problem. Sometimes a simple adjustment to your medication regimen can make a huge difference. Medical conditions can also contribute to leg cramps. Diabetes, for example, can cause nerve damage and poor circulation, both of which increase the risk of cramping. Kidney disease can affect your body's ability to maintain proper electrolyte balance. Thyroid disorders can affect muscle function. Peripheral artery disease reduces blood flow to your legs. Even something as common as flat feet can change the way you walk and put extra strain on your leg muscles. Your sleep position can also play a role in leg cramps. If you sleep on your stomach with your feet pointed downward, you're keeping your calf muscles in a shortened position all night long. This can make them more prone to cramping. Similarly, heavy blankets that press down on your feet can keep them in an awkward position that contributes to cramps. Overuse of your muscles during the day can also lead to nighttime cramps. If you've suddenly increased your activity level, or if you've been standing or walking more than usual, your muscles might be fatigued and more prone to cramping. This is why leg cramps are common among athletes and people who do physical labor. Now, let me tell you about some immediate relief techniques that you can use when a cramp strikes. The most important thing to remember is not to panic. It's easier said than done because the pain can be quite intense. But staying calm will help you think more clearly and respond more effectively. The first technique is gentle stretching. For a calf cramp, try to straighten your leg and gently pull your toes back toward your shin. If you can't reach your toes, you can use a towel or a belt to help pull your foot back. Hold the stretch for 30 seconds to a minute, breathing deeply. While you do it, the key word here is gently. Don't force the stretch, as this can actually make the cramp worse or even cause injury. Massage can also be very effective for relieving cramps. Use your hands to gently massage the cramped muscle, working from the edges of the cramp toward the center. Apply firm but gentle pressure and work in circular motions. Some people find that using a tennis ball or foam roller can be helpful. For this, heat and cold therapy can both be effective, depending on the individual and the specific cramp. Some people find that applying a warm compress or heating pad to the cramped muscle helps it relax. Others prefer ice, which can help numb the pain and reduce any inflammation. You can try both to see which works better for you, but be careful not to apply heat or ice directly to your skin. Always use a towel or cloth as a barrier. Walking can sometimes help relieve a leg cramp, especially if the cramp is caused by poor circulation. The movement helps get blood flowing to the affected muscle. Start by walking slowly and gently, and gradually increase your pace as the cramp subsides. There's also a pressure point technique that some people find helpful. There's a point on the back of your calf between the two heads of the gastrocnemius muscle that you can press firmly for about 30 seconds. This is similar to acupressure techniques and can sometimes provide relief. Now, while these immediate relief techniques are important to know, prevention is really the key to dealing with leg cramps. If you can prevent them from happening in the first place, you won't need to worry about treatment. Let's start with hydration, which I mentioned earlier as one of the main causes of leg cramps. I recommend that my patients drink water throughout the day, not just when they feel thirsty. By the time you feel thirsty, you're already mildly dehydrated. A good rule of thumb is to check the color of your urine. It should be light yellow. If it's dark yellow, you need more fluids. But it's not just about the amount of water you drink. It's also about timing. Try to drink most of your fluids earlier in the day and taper off in the evening, so you're not waking up multiple times during the night to use the bathroom. However, do have a small glass of water about an hour before bed if you're prone to nighttime cramps. Diet plays a huge role in preventing leg cramps. Make sure you're getting adequate amounts of potassium, magnesium, and calcium through your food. Bananas are famous for their potassium content, but they're not the only good source. Sweet potatoes, white potatoes with the skin on, spinach, and avocados are all excellent sources of potassium. For magnesium, focus on nuts like almonds and cashews, seeds like pumpkin seeds and sunflower seeds, whole grains, and dark leafy greens. Many people don't realize that dark chocolate is also a good source of magnesium. So you can feel good about having a small piece occasionally. Calcium is found in dairy products, of course, but also in leafy greens like kale and collard greens, canned fish with bones like sardines and salmon, and fortified plant-based milks. It's also important to limit foods and drinks that can contribute to dehydration or electrolyte imbalances. Excessive caffeine can act as a diuretic and contribute to dehydration. Too much sodium can upset your electrolyte balance. Alcohol can also contribute to dehydration and affect your sleep quality. Regular exercise is one of the best things you can do to prevent leg cramps, but it needs to be the right kind of exercise done in the right way. Gentle stretching, particularly of your calf muscles, should be part of your daily routine. Before bed, spend 5 to 10 minutes doing gentle calf stretches. One of my favorite stretches is the wall stretch. Stand about arm's length from a wall. Place your hands flat against the wall and step your right foot back about 2 to 3 feet. Keep your right heel on the ground and lean forward, feeling the stretch in your right calf. Hold for 30 seconds, then switch legs. Another good stretch is the towel stretch. Sit on the floor with your legs straight out in front of you. Loop a towel around the ball of one foot and gently pull back, keeping your legs straight. You should feel a gentle stretch in your calf and the back of your leg. Walking is excellent exercise for improving circulation and preventing leg cramps. It doesn't have to be intense. Even a 15 to 20-minute walk each day can make a significant difference. Swimming is another excellent choice because the water pressure helps improve circulation, and the exercise strengthens your muscles without putting stress on your joints. However, it's important not to overdo exercise, especially if you're just starting or if you've been sedentary. Sudden increases in activity can actually trigger leg cramps. Start slowly and gradually increase your activity level over time. Your sleeping environment and habits can also significantly impact whether you experience leg cramps. Make sure your bedroom isn't too cold, as cold temperatures can affect circulation and make muscles more prone to cramping. On the other hand, don't make it too warm either, as this can lead to dehydration. The type of bedding you use matters too. Heavy blankets or tight sheets that restrict the movement of your feet and legs can contribute to cramps. Consider using lighter bedding or looser sheets that allow your feet to move freely. Your sleeping position is also important. If you're a stomach sleeper, try to transition to sleeping on your side or back. If you must sleep on your stomach, try placing a pillow under your ankles to keep your feet in a more neutral position. Some people find it helpful to sleep with their feet slightly elevated. You can do this by placing a pillow under your feet, or by raising the foot of your bed slightly. This can help improve circulation and reduce the likelihood of cramps. There are also some specific techniques you can use before bed to prevent nighttime cramps. Warm bath or shower before bed can help relax your muscles and improve circulation. Adding Epsom salts to your bath may provide additional benefits, as Epsom salts contain magnesium that can be absorbed through your skin. Gentle massage before bed can also be helpful. You can massage your own calves or have a family member help. You use long, smooth strokes from your ankle toward your knee and spend extra time on any areas that feel tight or tense. Some people find that doing light exercises before bed helps prevent cramps. Simple ankle circles, pointing and flexing your feet, and gentle calf raises can all help improve circulation and prepare your muscles for sleep. Now, let me talk about when you should be concerned about leg cramps and seek medical attention. While most leg cramps are harmless, there are certain situations where they could indicate a more serious underlying condition. If your leg cramps are accompanied by swelling, redness, or warmth in your leg, this could indicate a blood clot, which is a medical emergency. Seek immediate medical attention if you experience these symptoms. If you're having leg cramps multiple times per week, or if they're severe enough to significantly impact your sleep or daily activities, you should discuss this with your doctor. Frequent severe cramps could indicate an underlying medical condition that needs treatment. If your leg cramps are accompanied by muscle weakness, numbness, or tingling, this could indicate a nerve problem that should be evaluated by a doctor. If you develop leg cramps after starting a new medication, contact your doctor to discuss whether the medication could be the cause and whether an alternative might be appropriate. If you have diabetes, peripheral artery disease, or other conditions that affect circulation, and you start experiencing leg cramps, this should be evaluated by your healthcare provider. There are also some supplements that might help prevent leg cramps, but I always recommend discussing these with your doctor before starting them. Magnesium supplements are often helpful for people who have low magnesium levels, but too much magnesium can cause diarrhea and other problems. The typical dose is 200 to 400 milligrams per day, but your doctor can help determine the right amount for you. Potassium supplements can also be helpful, but they can be dangerous for people with kidney problems or those taking certain medications. It's generally safer to get potassium from food sources rather than supplements. Some people find that calcium supplements help with leg cramps, especially if they don't get enough calcium from their diet. However, calcium supplements can interfere with the absorption of other nutrients and may increase the risk of kidney stones in some people. Vitamin D deficiency has been linked to muscle cramps in some studies. So if you're deficient in vitamin D, correcting this might help. Your doctor can test your vitamin D level with a simple blood test. There are also some alternative treatments that some people find helpful, though the scientific evidence for these is limited. Acupuncture has been used for centuries to treat muscle cramps and other pain conditions. Some small studies suggest it might be helpful, though more research is needed. Some people swear by quinine for leg cramps. Quinine was traditionally used to treat malaria, but it was also found to help with muscle cramps. However, quinine can have serious side effects, including heart rhythm problems and low platelet counts, so it's no longer recommended for leg cramps, except in very specific circumstances. Yellow mustard is a home remedy that some people claim works for leg cramps. The theory is that the turmeric in mustard has anti-inflammatory properties, or that the vinegar helps with electrolyte balance. There's no scientific evidence to support this, but it's generally harmless if you want to try it. Pickle juice is another popular home remedy. Some athletes use it to prevent or treat muscle cramps, and there is actually some scientific evidence that it might work. The theory is that the sodium and vinegar in pickle juice trigger a reflex that helps stop muscle cramps. However, the high sodium content makes this unsuitable for people with high blood pressure or heart problems. Let me share some more patient stories to illustrate how different approaches can work for different people. I had a patient named Frank, a 64-year-old retired police officer, who was getting leg cramps almost every night. When I reviewed his medications, I found that he was taking a diuretic for his blood pressure. We worked with his cardiologist to switch him to a different blood pressure medication that didn't cause potassium loss, and his leg cramps disappeared within 2 weeks. Then there's Maria, a 71-year-old grandmother who was having terrible leg cramps that were waking her up multiple times per night. When I examined her, I found that she had quite severe bunions and was walking in a way that put extra strain on her calf muscles. We referred her to a podiatrist who fitted her with custom orthotics, and she also started doing daily calf stretches. Her leg cramps became much less frequent and less severe. Another patient, James, was a 58-year-old accountant who spent most of his day sitting at a desk. He started getting leg cramps when he began training for a 5K race. The problem was that he had gone from being completely sedentary to running 3 miles every other day. We scaled back his training program and had him start with walking, gradually building up to running. We also made sure he was staying properly hydrated and getting enough electrolytes. His leg cramps resolved, and he was eventually able to complete his 5K. I also want to address some common myths about leg cramps that I hear frequently in my practice. One myth is that leg cramps are always caused by low potassium, so eating bananas will cure them. While potassium deficiency can cause leg cramps, it's not the only cause. And eating bananas alone won't solve the problem for everyone. Another myth is that you should always stretch during a cramp. While gentle stretching can often help, forcing a stretch when you have a severe cramp can actually cause injury. The key is to be gentle and listen to your body. Some people believe that leg cramps are a sign that you're not getting enough exercise, while others think they mean you're exercising too much. The truth is that either extreme can cause problems. The key is finding the right balance for your individual situation. There's also a myth that leg cramps only happen at night. While nighttime cramps are very common, you can get leg cramps at any time of day. The reason nighttime cramps are more common is probably because we're lying still for long periods, which can affect circulation, and because we may be slightly dehydrated by bedtime. Some people think that only old people get leg cramps, but this isn't true either. Athletes commonly experience leg cramps. Pregnant women frequently get them, especially in the later stages of pregnancy. And even children can experience leg cramps, sometimes called growing pains. Let me talk about leg cramps in some specific populations. Pregnant women often experience leg cramps, especially in the second and third trimesters. This is thought to be due to increased pressure on blood vessels from the growing uterus, changes in circulation, and increased nutritional demands. Pregnant women should talk to their healthcare provider about leg cramps rather than trying to self-treat. Athletes and people who exercise regularly can experience leg cramps due to muscle fatigue, dehydration, or electrolyte loss through sweating. For these individuals, proper hydration before, during, and after exercise is crucial, as is adequate warm-up and cool-down. People with diabetes are at higher risk for leg cramps due to nerve damage and circulation problems that can be caused by high blood sugar levels over time. If you have diabetes and are experiencing leg cramps, it's important to discuss this with your healthcare provider. Older adults are at higher risk for leg cramps for several reasons. They're more likely to be on medications that can cause cramps. They may have multiple medical conditions that contribute to cramping. Their circulation naturally decreases with age, and they may not drink enough fluids throughout the day. Now, let me give you a practical action plan that you can start implementing today to reduce your risk of leg cramps. First, assess your current hydration status. For the next few days, pay attention to how much water you're drinking and the color of your urine. If you're not drinking enough, gradually increase your water intake. Second, take a look at your diet. Are you getting enough potassium, magnesium, and calcium? If not, start incorporating more foods rich in these minerals into your meals. This doesn't have to be complicated. Adding a banana to your breakfast, having a handful of nuts as a snack, or including more leafy greens in your dinner can make a significant difference. Third, establish a bedtime routine that includes gentle stretching. Spend 5 to 10 minutes each night doing calf stretches before you go to bed. Make this as much a part of your routine as brushing your teeth. Fourth, evaluate your sleeping environment. Is your bedroom at a comfortable temperature? Are your blankets too heavy or your sheets too tight? Make any necessary adjustments to ensure your legs can move freely while you sleep. Fifth, if you're taking any medications, review them with your doctor to see if any could be contributing to your leg cramps. Don't stop taking any prescribed medications without talking to your doctor first, but do bring up the possibility that they could be related to your cramps. 6. Start incorporating some gentle exercise into your daily routine if you're not already doing so. Even a 15-minute walk each day can help improve circulation and reduce the risk of leg cramps. If you do experience a leg cramp despite these preventive measures, remember to stay calm and try the relief techniques I mentioned earlier. Gentle stretching, massage, heat or cold therapy, and light walking. Keep a cramp diary for a few weeks. Note when cramps occur, what you were doing before they happened, what you ate that day, how much water you drank, and anything else that might be relevant. This can help you identify patterns and triggers that you might not otherwise notice. Be patient with yourself as you implement these changes. It may take several weeks to see significant improvement, and you might need to try different combinations of strategies to find what works best for you. Remember that while leg cramps can be very uncomfortable and disruptive, they're usually not dangerous. Most people can significantly reduce their frequency and severity with the right approach. However, don't hesitate to seek medical attention if your cramps are severe, frequent, or accompanied by other concerning symptoms. I hope this information has been helpful to you. Leg cramps don't have to be something you just live with. With the right knowledge and approach, you can take control of this problem and get back to sleeping soundly through the night. Sweet dreams, and here's to cramp-free nights ahead.